Hello, welcome back. The topic today is diabetes and the myths around the diabetes. And people still believe, diabetes happens only when you eat sweets. Definitely no. Diabetes is a disease. It's a chronic disease where the blood sugar level is high because of there is less insulin or no insulin or insulin secreting cells are destroyed. So it can happen to anyone. And people think diabetes happen only for the obese people. No, even thin individuals, if they don't have any insulin or if their cells are destroyed, they can get diabetes. So it's all depends upon the amount of insulin, the effectiveness of the insulin, and the number of insulin secreting cells in the body. So the another biggest the wrong belief is, if you take something bitter, so the diabetes means sweets. So you take something bitter, it will neutralize, the sugar will come down. No, definitely no. Especially bitter gourd. So bitter gourd is the most of the people think if I eat bitter gourd, the sugar will come down. No, even if you eat bitter gourd, even bitter gourd will raise the sugar because whatever you eat that goes into the body and the sugar level increases. So bitter gourd has no effect on your insulin or no effect on your insulin secreting cells. The other next is neem leaf, neem tree leaf. People think it's bitter. So when I eat sweet, when I take something bitter, so it will neutralize. No, no effect on that. Then the karunjeeragam, that people have the craziness for that. Like it has no effect on your insulin. It has no effect on your insulin secreting cells. And even in people, some people have a, they eat, they think diabetics should not eat sweets. No, if they want, they can have it. But it's all depends upon how good your sugar control is. Suppose your sugar is under good control, once in a while, just to appreciate yourself, you can have some sweets. The same way people think diabetic people cannot have fruits. No, fruits are really simple sugars. They can rise immediately the blood sugar, but fruits like guava, unripe guava especially, orange, papaya, apple, they all have a low glycemic index. So the blood sugar level will rise only slowly. So people with good diabetes control, they can have it. Or even if they have a good control, once in a while, any seasonal fruits they like, they can have it. But they have to keep checking their sugars. Or some simply, you can replace any meal like lunch, dinner, you can replace it with fruits, because fruits are nutritional value is very high. So if they want, they can have it, but they have to keep a watch on this thing. The same way, people think diabetes will happen only for the aged people. No, it can happen for anyone. Even just born children that can get diabetes. That's called type 1 diabetes. What is that? Autoimmune disease. The insulin secreting cells are destroyed by our own body. So there is no insulin secreting cells, and they need insulin for their survival. So they can have a normal life with an insulin supplement. The same way, gestational diabetes. The pregnant women, the insulin is not the efficiency is not that efficient to take care of the sugar part. So they have to give insulin. Another common myth is artificial sweetness, and they will give advertisement. There is no calorie, no sweets, so no sugar. So these are the ads usually. They will attract the diabetic people. So this sweet has no sugar, so you can have it. No, so the sweet may not have that sugar, but it has a calorie, so that can increase your sugar. So even the festival time, they will give an ad. So this sweet is made up of without sugar, natural sugars and all. No, anything goes inside. Suppose you have a sweet. Suppose it's made up of carbohydrate kind of refined flour and something. So if you eat that, that itself will increase your sugar. So artificial sweetness the same way. Artificial sweetness may not have that calorie or that sugar part, but the substance that goes in, that has a calorie that will increase. So it's all depends upon your glycemic index, the amount of calorie, the amount of carbohydrate inside. So people with the diabetes have to be very careful when they get an ad, no sweets, no artificial sweetener, so you can have it. No. So diabetes is a chronic disease where the sugar level rises because of there is no insulin or less insulin, or insulin is there but it's not efficient, or the insulin secreting cells are gone. So that is why in the market, so much of medicine, so many tablets are available according to the need of the patient, age of the patient, weight of the patient, or other conditions of the patient. So diabetes has a lot of myths. So common myths are all, avoid all those things and consult a doctor. Diet, exercise, medicines. Diet and exercise is the primary thing, and of course medicine is also very important. Thank you.